Here's what I like. Menace response every time. Nice. That's left eye, right eye, blink every time. Nice and white. This is called the bulbar conjunctiva. That's just the conjunctiva that covers that globe. Mm-hmm. Both are nice and white, just like my lab coat. White eyes are happy eyes. Open eyes are happy eyes. No squinting, no redness. So far, so good. Now we'll look inside.
You're good. I like to show my kids too.
Yeah, cool. Absolutely. No problem.
One of them wants to be a veterinarian.
Ah, really? How old is
she's 7.
She's how old?
She's 7. She also wants to be a singer.
A singing veterinarian?
That's what I was saying. With Patch Adams from, is that what it was? Robin Williams.
It could happen. When she gets a little bit older, you tell her to come and hang out with us.
I will.
And show her what at least our little slice of veterinary ophthalmology is, or veterinary medicine is. Oh yeah, you got a lot of pigment in your corneas. So that's new to me, not new to Maya. But see this little brown haze? That's corneal melanosis, that little brown stuff in her cornea.
Oh, okay.
And it's actually worse on this eye. See all that brown stuff on the cornea, outer clear windshield? Now, the good part is it's not impeding my ability to see in. I can still see her retina and her optic nerve in the back of the eye. And her retina and optic nerve are fine. I can see in, she can see out. That's all good. So it's not limiting her vision. But the concern with corneal melanosis is that if it progresses over time, it can start to impair vision.
Okay.
If you get enough of that melanosis, dogs have these cells called melanocytes, and they're at the junction between the white part of the eye, the conjunctiva, sclera, and you can see it now here. It's like little swirls, and the cornea. And sometimes they tend to migrate over, and there's little swirls of pigment. Let me show you for your camera on with a broad light. This is bright Maya. Sorry.
Oh, those brown things.
The swirls of pigment. Yeah, they're kind of just migrating across the cornea. This one is the same. It kind of comes in a. The reason
I see a little white streaks. Is that?
Yeah, they're little brownish streaks.
Okay.
They're brownish streaks, and they kind of swirl, and that pigment gets deposited a little bit. I do not see any calcium or mineral. That shows up as kind of off-white sparkly stuff. Okay. So that part's good. EDTA is no longer needed if we're still using that.
We are. So no longer
We're going to switch that.
Okay.
EDTA is a chelating agent. Its purpose is to kind of pull some of that calcium out, that mineral out, and that's what was causing her a little bit of surface discomfort in the past, and that's gone. Okay. So that's good. So her eyes are, if she could talk, she'd say my eyes are comfortable. Fluorescein dye. This tells us if we have any corneal ulcers, erosions. I don't think so. This is a proparacaine. Okay, let's take it out. All right, baby, here we go. Going on a year, and this dog is looking pretty good. No uptake. Fluorescein, if it gets absorbed by the deeper layers of the cornea, and it actually fluoresces with a cobalt blue filtered light like we're looking at here, and there's no fluorescein uptake. That's good. Okay. No ulcers, did not expect any. If she would have had ulcers, she'd probably been squinting, but I always like to see what the tear film is doing. We're going to wipe your tears, and then we're going to check your pressures. There you go. Look at this good dog. She's a tough little dog, isn't she?
Oh, very.
Oh, very. Okay. Pressure check, normal 20. I do know she had a little bit of a tendency to have high pressure there. This is called a rebound tonometer, and that's 14. That's nice.
Oh, great.
Perfect, right in the middle. And that's 9, and that's fine.
Okay.
9 is fine. Close enough to 10, we'll call it normal. High pressure is what we're concerned about. This little beautiful dog is fine. Let me make a couple notes and figure out